She would be talking on AI in ophthalmology, changing paradigms.
So it's artificial intelligence in ophthalmology, the changing paradigms, how it is affecting our lives. So in this presentation, I'm going to tell you a little overview, and then AI as game changer in ophthalmology and in various aspects like diabetic retinopathy, ROP, ARMD, RD, in glaucoma, anterior segment disease, and so forth. So what is artificial intelligence? It's the study and development of algorithms that give machines the ability to reason and perform cognitive functions such as problem solving and decision making. So what is this? We often see this diagram. This is an input layer where a lot of information is put in the machine, and in the hidden layer that there is a deep learning procedure where there is a phenomenon called black box phenomena also, and this all information is taken towards the outer layer, and this is the output layer which we get as the final decision of the machine. So in artificial intelligence, there are various subfields like machine learning, deep learning, and convolutional neural network. Machine learning, it enables the computer or the machine to learn from examples from being explicitly programmed. Deep learning is the inside story of the machine, which it learns of itself, and neural network, in this, there is automatically the machine learns the spatial hierarchies of features, and the images are put through various convolutional operations. So how the algorithms are prepared? There's a data training set, first of all. A data set is used to teach an AI model to recognize various patterns and make predictions containing labeled examples of input data and their corresponding outcomes. Then there is a validation set over and above this input in the machine. A set of validation is, there is a data set which controls this and trains the machine and ensures that there is a generalization of the unseen data and it does not overfit. The major steps are the data collection, there is a pre-processing procedure, then there is a feature extraction, and the diagnosis and prediction of the final picture is taken thereof. So each step up, it adds value. From data, it goes on to information, information leads on to knowledge, and finally the machine gets the wisdom. So something like what we learn in human life. So there are various available systems for various disease entities like DEEP, ROP, IDEX, DR. They are for different entities like diabetic retinopathy, macular pathologies. We have Deep Minds, the Peak Vision system for analyzing smartphone images, what we get, and TopCon Aladdin slit lamp for anterior segment diseases. So then the overview, it's ocular disease, the significant cause of visual impairment and blindness worldwide. Early detection and timely treatment is crucial. Traditional methods, they are very time consuming and labor intensive. We require a lot of people who are trained. AI offers consistent, repeatable results without the fatigue. So what are the challenges? The manual diagnostic limitations, as we know, human error is always there. Could be a fatigue phenomena. We don't have so much manpower. High demand for eye care specialists are required in the peripheries as well. So AI it's a game changer in ophthalmology. It's a buzzword everywhere it is used nowadays. So what is this all about? There's an early diagnosis and risk stratification. AI-assisted screenings are there. Telemedicine platforms have been formed. They are very accurate, and with the things are done with speed. There is a scalability and cost effectiveness of this procedure. I don't know, in India, yet to have a lot of machines, but in other countries, in developed countries, there's a lot of AI working for ophthalmology. So it also helps in predicting the disease progression, treatment, and outcome. So there's a growing burden of retinal diseases in various aspects. This is the slide showing incidence and prevalences of various AI in retinal diseases. So I'm going to tell you a little bit brief about these entities. So AI in diabetic retinopathy, how we are doing it? By color photos, OCT, FA, and OCTAs. We grade the DRs, we identify the DMEs, and identify the NPDRs and PDRs, and find out who's healthy and who's a diabetic patient thereof. AI in color fundus photographs, we start from the input, convolution, deeper layers, max pooling, and the output, as I told in the beginning. So same is with, we have a lot of images taken from the fundus from various data is collected, and then neural networks will be applied, and deeper learning will help to find out what are the hemorrhages or exudates present. And finally, a picture is told to us that this is the final picture, and this is the stage of the disease of diabetic retinopathy. And so OCT also. OCT pictures are also fed as the fundus images. It helps in diagnosing DME, predicting the treatment responses. And we know the various layers. OCT will tell you what cystoid space is, as SRF is there as not, and what is the stage. Again, we can know what we can morphologically also see what OCT is telling us by this AI. AI and OCTA angiography similarly will help early identification. We can have a ischemic index. We can have vessel density significance can be visualized by these AIs. And then is the fluorescein angiogram. It also helps to find out what is the leakage, what is the microaneurysm count, and the CNP areas. Then is in ROP. ROP we need bigger machines. It's a little difficult because we have to take pictures in small children. So it is a little difficult procedure as compared to DRs, and it has to be done in NICUs. A lot of good cameras are required because the ROPs in the peripheries, they have to be taken with the bigger cameras, optos and something like wide field, and it is having some challenges as compared to the adults. So ROP screen is done with a deep ROP system. It has one ID net system and GR net. It identifies either ROP is there or not, ID net, and GR net will tell us whether there is a minor ROP or a severe ROP. So plus disease is also found out with this ROP screening by AI. Then in AMD, it is the screening and diagnosis, which is helps in timely detection of ARMD, and various algorithms are available for ARMD. AlexNet and Google LayNet also helps in predicting the visual acuity in ARMD, predicts the necessity whether we need to have anti-VEGF injections or not, using image biomarkers along with socio-demographic factors. What are the conversions from dry ARMD to VRMD? It can be predicted to some extent. Then AI in RD. So ultra-wide field imaging modalities, they are used. The program is Inception ResNet V2. At first step, it defines whether there is RD or non-RD, and then it tells whether it is a macula involving or non-macula involving. And this is how it is screening the things. And finally, it will give us information regarding preoperative posting of the patients, whether it will go to further progression or not. Then various limitations are there with these AI systems. The cost, high resolution, wide field imaging modalities are required. Lesser research and emphasis has been made. Can miss out on subtle lesions like retinal holes and lattices in the periphery, and we can miss the peripheral lesions. Then in what glaucomas, OCT can help in finding out, detecting and quantifying the RNFL thinning and optic disc changes. Visual field interpretations can be made. Risk stratification models can be known by knowing the genetics, history, IOP, and treatment responses. Teleophthalmology in remote areas by analyzing the fundus images and visual field defects, visual field tests can give us information regarding the glaucoma in a certain patient. Then in anterior segment diseases also it has worked wonders. Corneal tomography and topography can be done in keratoconus, and in knowing the thickness and abnormalities of the anterior chamber, cataract grading can be made out. We can optimize the IOL power calculation, and dry eye meibomian gland changes can be seen. A recent article in International Journal of Surgery, there is a study which is done in China, and it tells that 182 videos were taken of cataract surgeries of different surgeons, and they've defined 12 steps. So you can feed your surgery steps into that AI system, and it will tell deep surgeries it will provide a real-time supervision and objective surgical evaluation system for routine cataract surgeries, improves the quality of surgery, and you can reduce the demands on a senior ophthalmologist trainers for surgical guidance. So it may form the basis for establishing a standardized and efficient cataract surgery workflow. So it's a really nice article to be read. Then are what challenges we face with artificial intelligence? It often lacks diversity, leading to inaccurate results when applied to different population groups. Something which is applied to Africans or Americans may not be true for Indians. So there is a lack of human touch, this lack of infrastructure, particularly in developing countries. With limited internet, it hampers the effective implementation of AI systems. And falsely labeled laser marks, sometimes they can tell you that these are the local pigmentations, and we can be in trouble. It can tell us something different what a human can see. So limited accuracy where media opacities and artifacts are present. This is the limitation. Current AI systems can monitor only one disease at a time, making it impractical to switch between multiple systems, especially in resource-limited settings. Depending on the artificial intelligence, we may reduce the physician's decision-making skills and critical thinking. Data privacy concerns are there, definitely. Accountability for errors. Who knows? If the machine says something and the patient is not having, and we start treating the patient, that's a very challenging and questionable thing for AI. And then is the black box phenomena. We really don't know what the machine makes its own decisions sometime, which may be difficult to handle. So what is the future of AI? It is an expanding access to the remote diagnostics. AI integrated contact lenses can be there for 24/7 IOP monitoring in cases, especially in glaucoma. AI models can combine retinal images with genetic, lifestyle, and demographic data to create personalized treatment plans. So AI is revolutionizing management protocols, particularly in the areas of early detection, accurate diagnosis, and monitoring the disease progression.
Thanks a lot, madam. It was a very comprehensive overview of this complex topic, leaving very little scope for any discussion. I think our first exposure to artificial intelligence as anti-segment surgeons happened with HEAL RBF file power calculation. It was entirely based on artificial intelligence, and then of course the Kane formula and some of the newer formulas, then glaucoma progression analysis. But then this is an expanding field, and I think the future will determine what will be the human component in the management of the many disease conditions where AI is used.
It's quite interesting, and though it had started in 2000. If you see a lot of YouTube videos, there's a lot of, I said, it's a buzzword.
Yeah.
We are already using it quite a lot. And we don't know where we are going to land a few years from now. People say after 2030 or 2040, human and doctors will not be required or something like that. But some people say, no, it won't happen, ever. So controversies are there. We are already using so many places. When we Google the things, we get so many articles in one go, in one touch. So AI is happening everywhere. Siri, Alexa, everywhere AI is there. Yeah. So we were there using it for a long time, but